Hello everyone, welcome to my channel and you will learn health and medicine through my videos. Please hit like and subscribe and please hit the notification bell so that you don't miss my videos. Red color represents oxygenated blood and blue color represents deoxygenated blood. Heart's right side deals with deoxygenated blood and left side deals with oxygenated blood. Deoxygenated blood from upper body and lower body is given to right atrium of the heart, and from right side, that is right ventricle, the blood goes to lungs for oxygenation. After oxygenation, pulmonary veins takes the oxygenated blood back to the left side of the heart, that is left atrium. From left ventricle, the blood goes into the systemic circulation where cells, tissue and organs utilizes oxygen and nutrition for their metabolism. Here we can see that the deoxygenated blood from system goes to right atrium and then into the right ventricle, and when the ventricle is contracted, the blood is pushed towards the pulmonary artery and goes to the lungs where the bloods get oxygenated and returns to the left atrium, and from left atrium the blood goes to left ventricle, and from ventricle it goes to aorta into the systemic circulation. The arteries are broken down into arterioles and arterioles are broken down into capillaries where exchange of oxygen and carbon dioxide takes place. To summarize, the blood comes into the right atrium from the system and then it goes into the right ventricle, and through right ventricle it goes to lungs, and after oxygenation it returns to left atrium via the pulmonary vein, and from left ventricle it goes into the aorta, and from aorta it goes into the system. Now we will see the valves in detail. Between right atrium and right ventricle, you have right atrioventricular valve, which is tricuspid. Between right ventricle and pulmonary artery, you have pulmonary valve. Between left atrium and left ventricle, you have left atrioventricular valve. And between left ventricle and aorta, you have aortic valve. Septum separates the right side of the heart from the left side. Now, with the help of box diagram, we can easily understand the blood flow. The top two squares represent atrium and the bottom squares represent ventricles. Between atrium and ventricle you have your valves, and between ventricles and blood vessels you have pulmonary valve and aortic valve respectively. The oxygenated blood from left ventricle through aortic valve goes into the system, and through system deoxygenated blood returns to right atrium through superior and inferior vena cava, and from right atrium through tricuspid valve it goes into the right ventricle, and from right ventricle through pulmonary valve it goes to lungs for oxygenation, and after oxygenation it returns to left atrium through pulmonary veins, and through bicuspid valve it goes to left ventricle and then again goes into the system through aortic valve. You should always remember that ventricles pump blood away from the heart and atrium receives blood from veins. Right atrium receives blood from vena cava and left atrium receives blood from pulmonary vein. We can summarize blood flow with the help of blood flow chart. Right atrium goes to right ventricle through right atrioventricular valve, and from right ventricle it goes to pulmonary artery via the pulmonary valve. Pulmonary artery gives blood to the lungs where it gets oxygenated and goes to left atrium. Through left atrium, the blood goes to left ventricle through left atrioventricular valve, and from left ventricle, the blood goes to aorta through the aortic valve and into the system. From system, the blood returns to right atrium through superior vena cava and inferior vena cava. Hence, we can say that atrium receives blood from veins and ventricles pump blood into the arteries. Right side of the heart deals with deoxygenated blood and left side of the heart deals with oxygenated blood. External respiration occurs in lungs, whereas internal respiration occurs in tissues, organs, and cells. I hope through this video you all understood pulmonary circulation and systemic circulation. In the next video, we will see heart's physiology in detail. I request you all to please like the video and do comment if you have any queries or if you want to leave a suggestion. For more quality videos like this, please subscribe my channel and hit the notification bell so you don't miss out on any of my videos.